Hi, my name's Ben. Welcome to my YouTube channel, which is focused on managing eczema naturally. In this video I'm going to talk a little bit about my background and history with eczema, 10 different areas that you can focus on to try to manage your eczema using natural methods, and also a tip to start to reduce the symptoms of your eczema straight away. So firstly, I've had eczema all of my life. I'm 33 now, and I think that there are a number of different ways which are effective to different degrees of different people, but can be used to manage eczema so that the symptoms, itching and rashes, are reduced massively, to the point where you don't need to use topical corticosteroid creams or antibiotics, and you don't have any visible rashes. I think that that's achievable for many people with eczema, maybe not for all, but certainly we can all take steps to reduce the symptoms using natural methods, and I want to share those with you. I'm not a medical doctor. I work as a lawyer and I don't have any medical training, so this is purely based on my research, my experiences and experiences of others, but I do try to be scientific and I don't have anything to sell. So hopefully the information that I share in these videos will be helpful to you. I had eczema badly between the ages of 2 and 4 years old, so I would bleed at night and had to wear gloves, and apparently it covered my whole body. I don't really remember. At the time it went away after 2 years. That could have been because my immune system developed, I could have grown out of it slightly, or it could be the fact that I used homeopathic remedies and also allergy desensitizing injections. I don't know, perhaps a combination of all of those. Then it came back when I was about 14 or 15, and I had it badly through that time up to the age of 28, mostly on my face and arms, but also other parts of my body, and at some point it did cover my body. I used Chinese medicine for about a year, and that did have some impact, but not a great one, and so ultimately I became addicted to topical corticosteroids and was using them twice a day for 13 years. And I remember at the time my doctor sort of gave them to me, and they worked like a miracle, and you know, they allowed me to live a normal life and study and do sport and, you know, go out and drink with friends and that sort of thing. So it was, you know, I felt like I couldn't survive without them, and when a doctor suggested that I stop using them, I actually changed doctor to get another prescription. So I was, you know, I don't think at the time I could have managed without them. Then at 28 the eczema started getting worse and worse, and it got to the point where even though I was using topical steroids twice a day, I couldn't manage. So I needed to learn about eczema and about what can trigger it, and how to deal with inflammation in the body, how to avoid toxins that can exacerbate eczema, and basically manage it naturally. And within a few months of, you know, study and making changes to my lifestyle, I managed to reduce the eczema to the point where I was not using topical corticosteroid creams and had no visible eczema. And that lasted for about 3.5 to 4 years, then I had a massive flare-up, and that was sort of 8 months ago, but now I'm back to normal. I don't have any visible eczema. I do itch a little bit every day, but nothing severe, and it doesn't really affect my life at the moment. And there are a huge number of things that I've learned that I want to share with you, so that you can sort of benefit, hopefully benefit from them. They might work for you, they might not, and you know, it's worth a try, I think. As I say, I try to be scientific, so where there's research supporting what I say, I'll try and mention that either in the videos or in the articles. Okay, so there are 10 areas that I've learned about which can be helpful to eczema sufferers in terms of reducing their symptoms. Firstly, eliminating certain foods from the diet. There are a number of different foods which eczema sufferers are often allergic to, and it's different between each sufferer. So a good thing to do is get a RAS, the allergy test, a blood test, which shows what your allergens are. But as well as that, there are foods which are commonly eaten which have been shown to be detrimental to eczema sufferers and also to our health in general. So I want to sort of list out what those are and make suggestions about how you can remove them and replace them with healthier foods. Secondly, nutrition. We need foods to provide us with all the macronutrients and minerals and vitamins required for a healthy, strong body and immune system, particularly in eczema sufferers, because our immune systems are often compromised and overworked. So I want to share with you, what healthy foods are, and if you're not allergic to them, encourage you to eat them. And then thirdly, diet. So combining the first two, there are many diets which seem to be helpful for eczema sufferers, and these can vary between sufferers. So the GAPS diet is often useful. The raw vegan diet. I was raw vegan for 3.5 years. I'm not anymore, and I think that can be beneficial in the short term for some eczema sufferers, not for all. The paleo-primal diet, the body ecology diet, the specific carbohydrate diet, and a ketogenic diet. All of those diets can have a positive effect on an eczema sufferer and that person's symptoms. So I want to kind of introduce them to you and see if you think that any might be suitable, and then you can experiment and see if they're helpful for you. Fourth, digestion. Often eczema sufferers have a weakened digestive system in one way or another. We can have low enzymes or enzymatic problems in terms of breaking down the food, low stomach acid, gallbladder problems, and or we can have some kind of infections within the intestinal tract, and all of those can exacerbate eczema, because it appears that eczema is, as well as an allergic reaction, can be linked to problems with the digestive system. So I want to talk about that and sort of give you some suggestions on how you can identify any problems and then work to remedy them. Diagnosis. There are a number of tests and methods which can be used to identify systemic weaknesses or infections or other problems with the body. For example, nutritional deficiencies. And you can take those tests and then work to remedy them so that you can build up the strength of your body and reduce inflammation. So you can make your body healthier, basically, and that means that usually a healthier body will have less eczema. I'll go through what those are. I've already mentioned a couple, one including the RAST allergy blood test, which is an important one, I think, for most eczema sufferers to take. Supplements. There have been a number of scientific sort of studies looking at the effect of different supplements. The results have varied, but there are some which appear to have an impact in some eczema sufferers, so I want to talk about those. And the list is quite small, I think. There are many anecdotes about a huge number of different supplements and skin creams that have been effective, but it's hard to know whether to trust them, and there's not a great deal of scientific evidence behind them. So I'll be fairly brief on that, and as I say, I don't have anything to sell, I just want to share what I know with you. Environment's an important one, so there can be allergens in our environment, for example, chemicals from cleaning products, hygiene products, dust, wool, animal dander and others, which can have an impact on eczema sufferers and we can be allergic to, sometimes without realising. So I want to go through what those are commonly and then give you some tips on cleansing your environment so that you can reduce the amount of potential allergens that you're exposed to. Lifestyle's important, so things like exercise, breath work, habit management when it comes to eczema, and particularly when it comes to itching, the location that you live in, the sort of the climate, things like sunbathing, all of those can have an impact on eczema sufferers, and many have been shown through scientific studies to be particularly important to be aware of when you do have eczema. So I wanted to talk about those and hopefully you'll learn something from me about them. Independence. I want to talk about the risks and benefits of commonly prescribed medicines on the basis that I'm not a medical doctor, and in particular topical corticosteroids, which certainly can be very, very useful in the short term for many eczema sufferers, but there do appear to be considerable long-term risks. I myself have been damaged by topical corticosteroids, and I wish I knew sort of back when I started using them what those risks are, and my doctor had actually given me sort of a proper understanding of the fact that you want to avoid using them in the long term. So it's important to try to, if you can, get your eczema to the point where you're not relying on topical corticosteroids and you're managing your symptoms. So you're working on all of the points that I mentioned above to reduce inflammation in your body and reduce allergic triggers and reduce your exposure to toxins, so that you can be independent and not have to rely on prescribed medicines. And then finally maintain, I've gone over a lot of things there, and if you were to incorporate all of them into your life, then that would probably involve a considerable change in lifestyle. So what I want to do is talk to you about how you can make those changes and then maintain them in the long term. So I hope that's been helpful so far. Something that you can do right now to start to but manage your symptoms is just have a look at the videos on this YouTube channel, have a look at the articles on my website. I've tried to back up what I say with scientific research, so there are lots of references there to studies, and thanks for watching.